It's a feeling many of you know all too well, that creak in your knee when you stand up, the stiffness you feel first thing in the morning, or the dull ache that follows you around after a simple walk in the park. This is often the reality of living with knee osteoarthritis. It's an incredibly common condition affecting millions of people, and it can slowly start to dictate what you can and can't do. It might make you think twice about playing with your grandchildren, enjoying a walk with a friend, or even just managing the stairs at home. This isn't just about physical pain. It's about the way it can shrink your world and steal your joy. So, what exactly is happening inside your knee? Think of osteoarthritis as a bit of wear and tear on the joint's protective cartilage. This cartilage is the smooth, rubbery tissue that cushions the ends of your bones, allowing them to glide over each other with ease. Over time, this cushioning can wear down. When it does, the bones may start to rub together. This can cause pain, swelling, and stiffness, making movement difficult. It's not something you did wrong. It's a process that can happen with age, past injuries, or just genetics. But understanding it is the first step toward managing it effectively. For many years, the first thing people reached for was a pill. It's an understandable reaction. When you're in pain, you want fast relief, and popping a tablet seems like the simplest solution. Doctors have often prescribed anti-inflammatory drugs or painkillers to manage the symptoms of knee arthritis. These can certainly help to reduce pain in the short term, and they have their place. However, they don't solve the underlying problem. They are like a temporary patch, masking the pain without addressing the health of the knee joint itself. Relying on them for a long time can lead to other issues. The good news is that we are learning more and more about better ways to manage this condition. We are discovering that simple, gentle approaches can often provide more lasting relief than medication, without the unwanted side effects. It's about shifting our focus from just masking the pain to actively improving the function and strength of the knee. This is a more empowering approach. It puts you back in the driver's seat of your own health, using your own body's incredible ability to adapt and heal. It's about building a stronger foundation for a more active and comfortable life. When you visit a doctor for knee pain, a prescription for medication is often the first suggestion. The most common types are non-steroidal anti-inflammatory drugs, or NSAIDs for short. You might know them by names like ibuprofen or naproxen. These drugs work by blocking the chemicals in your body that cause inflammation and pain. And for a short while, they can feel like a miracle, allowing you to move with less discomfort. But they were never designed to be a long-term solution for a chronic condition like osteoarthritis. They are a quick fix, not a lasting strategy for health. The main issue with relying on these medications day after day is the risk of side effects. Our bodies are complex systems, and what helps one part can sometimes harm another. Long-term use of NSAIDs can be tough on your stomach, leading to ulcers or bleeding. They can also increase your risk of heart problems and kidney disease, which are serious concerns, especially as we get older. Painkillers, particularly stronger ones, carry their own risks, including dependency and constipation. These aren't small things. They can significantly impact your overall health and well-being in the long run. Think about it this way. Taking a painkiller for arthritis is like turning down the volume on a fire alarm while the fire is still burning. The alarm is the pain, and it's trying to tell you something is wrong with the joint. The pill makes the noise go away, but it does nothing to put out the fire, the underlying issue in your knee. To truly manage osteoarthritis, you need to address the fire itself. This means improving the strength of the muscles that support the knee, reducing the strain on the joint, and improving its flexibility. Medication simply can't do that for you. This is why looking beyond the pill bottle is so important. We need to find solutions that are not only effective, but also safe and sustainable for years to come. The goal should be to feel better without introducing new health problems. The best treatments are those that work with your body, not against it. They help you build resilience and function, so you depend less on medication and more on your own strength. It's a kinder, gentler, and ultimately more powerful way to take back control from knee pain and live your life more fully. Recent scientific studies have given us fantastic new insights. Researchers looked at many different non-drug treatments to see what really helps people with knee osteoarthritis. The results were clear and exciting. 3 simple therapies stood out from the rest for their ability to reduce pain, improve movement, and ease stiffness. These winners were wearing a knee brace, doing gentle exercises in water, known as hydrotherapy, and engaging in regular, land-based physical activity. These aren't complicated or expensive treatments. They are simple, accessible tools that you can start using to feel better. Let's talk about a knee brace first. It might sound too simple to be effective, but a good brace can make a world of difference. It works by providing external support to your knee joint. For some people, it helps by taking a bit of pressure off the damaged part of the knee, shifting the load to stronger areas. For others, the gentle compression provides a feeling of stability and warmth, which can reduce pain and make you feel more confident when you move. It's like giving your knee a helpful hug, reminding it that it's supported and safe as you walk. Next, we have hydrotherapy, which is just a fancy word for exercising in a swimming pool. Water is a wonderful environment for sore joints. Its natural buoyancy supports your body weight, which means there is far less impact and strain on your knees. You can move, stretch, and strengthen your legs in the water in ways that might be too painful on land. The gentle resistance of the water also helps to build muscle strength without you even noticing. A simple walk across the shallow end of a pool or some gentle leg lifts can be incredibly therapeutic and effective. Finally, there's land-based exercise. This might sound intimidating if you're in pain, but the key is to start gently. It doesn't mean you need to run a marathon. Simple activities like walking, cycling on a stationary bike, or doing specific strengthening exercises can build up the muscles around your knee. Stronger muscles act like a natural brace for the joint, absorbing shock and providing better support. This reduces the stress on the cartilage and can significantly decrease pain over time. The phrase "motion is lotion" is really true here. Gentle movement helps lubricate the joint and keeps it healthy. It is worth noting that the same big research study found that some other common treatments were not as helpful. Things like ultrasound therapy, for example, did not show the same strong benefits for pain and function. The message is clear. We should focus our time and energy on the things that we know work best. The top three, braces, water exercise, and land-based activity, are proven winners. They are also wonderfully safe. Unlike medication, they have virtually no negative side effects. They don't harm your stomach or your heart. In fact, they improve your overall health. One of the best things about these therapies is that they are affordable and easy to access. You don't need expensive equipment or specialist appointments that are hard to get. A good knee brace can be purchased at a reasonable price from a chemist or online. Many local community pools offer hydrotherapy classes or have public swim times that are very affordable. And land-based exercise can be as simple as going for a daily walk in your neighborhood or following a free exercise video online in your living room. These are realistic solutions for real people, without a big financial burden. The most important next step for you is to have a conversation with your healthcare provider, whether it's your GP or a physiotherapist. Talk to them about these options. Ask them if a knee brace might be right for you. Inquire about local hydrotherapy programs. Work with them to create a simple, gentle exercise plan that is tailored to your specific needs and abilities. They can guide you on how to start safely and progress at your own pace. This is a team effort, and your doctor or physio is your best coach. Please don't feel discouraged by a diagnosis of knee osteoarthritis. It does not have to be a life sentence of pain and inactivity. There is so much hope. By embracing these simple, safe, and effective therapies, you can take meaningful steps to reduce your pain, improve your mobility, and enhance your quality of life. It's about making smart choices that empower you to live better, for longer. You have the power to change how you feel, starting today, with one small, gentle step at a time.